pharmaceutical journals.
Chemist and Druggist and Pharmacy magazine will give us most of the information.
Because they're quite good to access online as well.
Yeah.
So you've got online and then obviously paper, so they're always a good one to go with.
The RCN do speciality journals like primary health care, and then there's independent nurse, nurse practitioner, and all those sort of. And so they tend to have articles pertinent to your area of practice rather than having to search through to find something relevant to where you work.
I think when you refer to the OTC preparations, I mean, we're human as well as being healthcare professionals, so we read magazines, we read the newspapers, we watch the television, we listen to the radio, we use the internet. So the advertising role is as good for us as it is for the general public, and maybe the adverts can actually deliver more information that would be relevant, on how something works, what it's for, rather than being a pure advert. So it's more of an advertorial than simply an advert.
I can remember the last time I looked at GP or Pulse and really looked at an advert. If it's a double-page spread, you just straight over. Mm-hmm. You're looking at the text, you're looking to read stuff.
If it's clever, there was a fantastic advert years ago for Flomax, which had an elderly gentleman with a hose pipe in his allotment, with a lovely thing. I know, I remember it 15 years later, and it was clever. But some of them are not very interesting. And I'll often get asked by companies, how do you want to receive written information? Simple answer. One side of A4, bullet points, little text. That's it. Because that's what I'm going to read, that's what I'm likely to remember. If you bury it in some flowery text, it's not going to get read. I think one of the challenges is that companies want a one-size-fits-all method of delivering information. We all learn and gather information in a variety of ways. I think marketing budget would probably be better spent informing me as a GP on OTC products, because I have a better knowledge of what I can prescribe. I'm also limited by formulary as to what I can prescribe, and I have very little knowledge of what the range of products are available.
OTC is the main area, I think, where you can get involved as a marketing team. And I think television is quite a big one, because I often have to sort of keep track of adverts, because I'll often find adverts before I've even been sent anything by the companies, because patients will come in and say, oh, I've seen this new Nicorette spray, or whatever. So I have to keep on top of the adverts because I haven't been sent anything before the patients have seen it on TV, and then they come in and ask for it.
I'd sort of bow to the pharmacist's knowledge of OTCs, and I would say to a patient, well, go down to the pharmacist and get a non-sedating antihistamine, for example. In other words, so they come to you and say, can I have a non-sedating antihistamine? And you can say, right, there we are. And essentially you can steer them if you want to any particular one. But I don't often name a brand too readily.
I think when information, as the doctor said, if information is related to GPs about OTC products, giving the doctors costing is very, very important. They need to know how much a product is before the doctor can decide whether to prescribe it or send the patient to the local pharmacy.
I have no idea, generally, how much an OTC product costs.
Absolutely, and it's very important for doctors to know.
Knowledge of their product, not having to rely on a cue card, and every time you ask them a question, they say, repeat the words that they've just spoken to you.
I had a rule in practice when I was seeing reps, and the practice manager let them know this, that if they sat with the detail aid going through it, then that was the end of the meeting. They had to put the detail aid aside, and we had to talk about the product.
And possibly a follow-up, because I would rarely see anybody after the initial information giving to see if their product is being used or if their information has helped at all, or if there's been an increase in the sale of that product or anything like that. I never see anyone again to follow it up.
Time is a very serious issue in, I'm sure, all the professions, but particularly in pharmacy. Gone are the days where we had the time to put aside and talk to a rep. We don't have that time anymore. They need to talk to you for a minute, and that's possibly a couple of minutes is the most we can spare. So it has to be very, very brief.
They're more likely to have time to see somebody if you've gone to a conference and they've sponsored it and they have a stand at a conference. You're more likely to go around an exhibition and decide which products you haven't or want to know more about, and actually elect to find out more about it.
Catching people outside of the practice in some way, whether that's conference, whether that's a briefing, whether that's an educational update, is a better route, because the reality in the working day is that there isn't the time.
And I entirely agree with others that the only time when I see reps from the industry is usually at meetings or conferences, and where we go and speak to, at meetings. And I have to say that I've picked up information that has been useful. In fact, the last time I went, I met a rep. He showed me a calcium vitamin D tablet, which was actually about a quarter the size of the ones that my patients can never swallow. Now, it's the sort of information I would never ordinarily have picked up. There's no way I would have picked it up by just looking at the BNF. And so there's certainly a value.
Yeah, I don't know how effective I find the reps when they come. I don't know if it's different when they come to the GPs, but they come to a pharmacy, they'll come to the counter, just hand you over a few bits of paper, give you a quick brief, and then they're gone again.
I think we all have commercial hats on us. If I know a rep is going to sponsor an event that I'm going to organise, then I think, I'm going to make time to come and see you. I like to see a familiar face. So if I see a rep who's been with a company for 5, 10, 15 years, I'll make more of an effort to go out and talk to them, because I've been talking to them for years. But if I see a strange face, I don't know which company they're from. And if I'm busy, I'm more likely to say, look, I haven't got time to see you. But if it's somebody I've been talking to for years, even if it means coming out and having a little social chat. So familiarity is very important.
I think the most important thing is that they know their product and they're willing just to have a conversation rather than sit with a detail aid and give you a semi-lecture or a semi-presentation. And they're willing to take away questions if they don't know the answers and come back.
I don't feel I should be out there to see reps. If my other staff are able to talk to one of the reps, I find that's sufficient. They don't need to take my management time away from me. So if my staff are able to talk to them and the reps can train them, because they're in the forefront, they're the ones that are talking to patients. Of course, we come in when it's necessary, but a lot of the times they're in the forefront talking to patients. If the staff are trained, reps don't need to see management, reps don't need to see senior staff. They can talk and train the people out in the forefront. And I'm sure other organisations like doctor surgeries, I'm sure they can see other staff.
I think it would depend if it was OTC or prescribed medicine. Obviously, if it's an OTC medication, go straight for the counter staff. Don't bother with us. It's a bit of a waste of time, because the amount of time we actually spend on the counter.
And take their over-the-counter products to those conferences as well as prescription articles, because we want to know more about it. I mean, for instance, at the last RCN Congress, there was a big article about a foot product, and they did really well. They actually demonstrated. I think we all took some to try overnight, and it wasn't a product that you'd necessarily have known anything about. I'd definitely never seen a rep within a practice or had any literature sent to me, and I think we all benefited, and I'm sure they did, having 1,500 nurses all passing through their stall, and it wasn't the typical sort of thing that you'd expect to see, so it was very worthwhile.
What I've seen as an increasing phenomenon is often advertisements that will actually highlight to GPs where the drug has had endorsement from NICE often I've not been aware of certain NICE recommendations until I've seen the advert. Now recommended as stage 2 in NICE guidance. Now, as a GP, I have to say that will have much more impact on me than a product that is just standalone marketing itself, because we've all actually been conditioned into prescribing products that have got the stamp of approval. An asthma product that says recommended as part of the BTS guideline. I mean, for example, it makes a very big difference.
It does.
Now approved, as part of a very established management guideline adopted nationally, it makes a big difference.
What you see is Nicorette. You don't see patch, you don't see gum. It's Nicorette. And Nicorette is the name. Nobody knows anything. Right, Nicorette, fine. It's Nicorette.
Because the combi bit, the actual product that they're selling is tiny in the corner.
What's fascinating about this is that you showed it as, is it a wraparound, are they called, on the magazine, and that's the first thing that gets torn off, put in the bin, so you can read the front page.
Yes.
And these things are really expensive.
No, yeah.
You might as well stand in a cold shower tearing up £50 notes.
It just says nothing. It doesn't stand out at all.
No. I think that tear it straight off and bin it.
It just looks lazy. Because they're not bothered about the combi bit. They're not, to me it seems like they're not trying to sell the combi as such. They don't seem to have really made much effort to, if it's a new product, to sort of bring your attention to that. It's just Nicorette.
And I suspect I will remember this because it's so rubbish.
I would glance over that one. I would read the bullet points of that one.
Definitely.
What's appealing about this is, obviously you've got a child and you've got the nice bullet points, and we all recognise this is Nurofen colours, so we feel familiar with it.
I think it's the colour. The colour is very catchy. And in fact, interestingly, that there's nothing in the content that's particularly punchy or particularly novel or new, but it's the colour.
I think there is a role for this, for GP Press, because I understand the company has done research that shows that the majority of GPs actually don't know that this even exists for children. And we are faced with parents who say, can I give Nurofen? And often the response is, no, you mustn't, because they don't realise that there's a specifically formulated product for children.
Yeah, it's quite bold, it's quite brief.
Yeah.
I think you could also possibly use that as almost as a poster as well. You could take it out of the magazine and maybe pop it up in a consultation room or something in the pharmacy just as an extra. And I think if you could do that with an advert, that's quite a big thing for the company.
This is a consumer advert that's been stuck into a GP publication. What I would like instead of that is something of the evidence. Give me the percentage, give me some reference to the study. I don't know what the word authorised, I've never seen authorised in this. You normally see approved or supported or recommended.
Yeah.